Welcome to this weekly COVID-19 update. My name is Dr. Agnes Mahomva, the Chief Coordinator for the National Response to COVID-19 pandemic here in Zimbabwe. Mr. Noble Mawungwa is on the sign language desk today. As of 11 November 2020, Zimbabwe had 8,667 confirmed COVID-19 cases, including 8,046 recoveries, 255 deaths, and a case fatality rate of 2.9%. The highest number of cases has been confirmed in Harare Metropolitan Province with 3,333 cases and 121 deaths, followed by Bulawayo Metropolitan Province with 1,767 cases and 65 deaths. The 7-day rolling average for new cases has increased since last week. Of big concern is the sharp increase in the number of imported cases recorded this week. The majority of these imported cases came from South Africa. This week we have therefore seen an increase in recorded new cases, a spike in our cumulative case curve, a sharp increase in the total number of imported cases, and a case fatality rate that is higher than the regional average. Many questions have therefore been asked. Is the country beginning to experience the start of a second wave? Should the country put in place a second total lockdown? In other words, what is it that we need to do to stabilize the situation and hence continue on the recovery path that the country has been experiencing since the end of July 2020? Government is very clear on what needs to do. It is focused on strengthening the national response using evidence-based strategies and approaches. The public health and social measures that the nation is currently implementing are very much evidence-based or science-based. Individuals and communities, we are therefore urging you to strictly adhere to all these recommended public health and social measures, these preventative measures, such as the proper wearing of your face mask. Please make sure that it covers both your nose and your mouth. Very, very important indeed. The spike in cases and deaths that we are witnessing globally and now locally here in Zimbabwe is a simple indication of how well, or should I say how poorly, these science-based public health and social measures are being implemented and adhered to by all of us. The non-adherence to preventative measures that we are seeing in our communities, as well as the limited enforcement of these measures, is really contributing to the increase in new cases. We need to take all these measures seriously if we are to contain COVID-19. Let me remind you once again, these include social distancing, at least 1 to 2 meters apart. Avoid crowds. Wear a face mask, as I have said again. Wear a face mask in public and ensure that it covers both your nose and your mouth. Frequently wash your hands with soap and running water, or frequently sanitize your hands with an alcohol-based sanitizer. If you suspect or you do have COVID-19, isolate at home to avoid spreading the disease. These are the measures that have been proven to work. Government is working on strengthening communication on what this epidemic really means for you and your community at all levels. Government is also working very hard to strengthen the enforcement of all these measures that we really need to all adhere to. Let me come back to the question of a second total lockdown that many have asked me this week. There is always room to visit or revisit this important measure. A total lockdown at the very beginning of this epidemic indeed helped the nation, our country, and we were able to put in place strategies and preparations in place before we started seeing an increase in our numbers. Our new normal should really not be defined by repeated lockdowns. It should instead be defined by adhering to existing preventative measures. These measures are inexpensive, easy to implement, and they work if properly adhered to. So what else is new that you need to know this week? Reopening of schools in a phased approach has continued, with phase 3 having taken place this week on the 9th of November. Government continues to work on a number of identified challenges to make sure that the school environment is safe from COVID-19. Finally, let me remind ourselves that the goal of the national response is to minimize the impact of COVID-19 with a focus on morbidity and mortality. Government is, however, also paying very close attention to the impact of COVID in other areas and not just on health. The national response includes, therefore, work with all other sectors. And this is being done through the 8 subcommittees of the COVID-19 Interministerial Task Force. Each subcommittee is headed by the ministry responsible for that particular subsector. And the subcommittees include the health strategy and infrastructure that we talk a lot about here every week. Food, Water and Sustainability Subcommittee that focuses on social welfare of the public, including quarantine facilities. The Materials Production Subcommittee that focuses on industry, especially local production of COVID materials and other materials. The Law and Order Subcommittee, which focuses on enforcement of the COVID-19 regulations. Transport, Logistics is another subcommittee. Resource Mobilization, another. Risk Communication and Information, another subcommittee. And of course, finally, the actual implementation, monitoring and evaluation, a subcommittee. So government is paying attention not just to the health aspect of this response, but all other sectors as well. So once again, COVID-19 is a very serious and deadly disease. Your continued participation in the national response is vital. Do therefore tune into ZTV, the radio and other media platforms for this weekly update. We need to continue working together. Thank you.